Good afternoon. My name is Reverend Charisma Jean Marie, and I'm the Director for Racial Justice Ministries at Scarritt Bennett Center. And today we come live to share more information about COVID-19 as it related to children. And so this afternoon, I'm excited to partner with Meharry Medical College as the pediatric doctor team come to share about the summer months and how families can protect and care for their children during the summer months. But right before we get started, we would be remiss not to talk about or mention what's happening all over this country in the Black community, not just in the Black community. Racism is not a Black issue. Racism is a humanity issue. So what's happening in our country that's directly affecting the Black community? And so I am excited to introduce Tequila Johnson. She is one of the co-founders of Equity Alliance, one of the most grassroots and most active organizations right here in Nashville, Tennessee. There's a demonstration that's happening in our community this afternoon, and she's coming to share a little bit about what's happening today, how you can participate, whether physically or otherwise, and what's to come in the next few days and months. Tequila, thank you for being here. Won't you share with us what's going on with Equity Alliance today?
Thank you so much for having me. Right today, what you see is it's not an Equity Alliance event. This isn't something that's about an organization or about a person. This is about the mission, and the mission is liberation for Black people. This is a mission that has been fought in this country since we arrived, and what you're seeing around the country is that people are now waking up to the injustices that Black people have faced as a result of racism and white supremacy in this country for generations and for centuries. And people are fired up, and they want to be a part of something. They want to let their voices be heard. And we felt like in Nashville that was needed. So what happened was collective impact. You have several Black organizers and organizations that came together and said, let's do something together to support our community. I would love to have to shout out the Brothers Roundtable, who initially had this idea to do a rally, and we all decided that we would come together, we would bring our specific areas of expertise, we would advocate for the issues that we've been advocating for in our communities for the last hundreds of years, and we would bring those issues to the forefront and utilize this as an opportunity to not only give people an outlet to vent their frustrations, but to begin to channel those frustrations into actual actions that we can go forward and push for in the days to come. So you asked, what will you see next? You will see what you've already seen, which is organizations like the Equity Alliance continuing to push for a Black agenda. We've had conversations about the next step of bringing all of the Black leaders together and sitting down and figuring out what are our asks? What do we want as a Black community? And how do we use this momentum right now to push those asks in front of the right people so that they know not only are we willing and ready to stand up and to protest for our rights, but we're taking those rights to the polls as well. And I've said this several times this week, any elected official, anybody who's in positions of power that does not respect those asks will be unseated. And we will not stop until every eligible Black voter is registered and at the polls.
Awesome. Tequila, I'm in Georgia right now. My heart is in Nashville. I really wish that I can be there today. Tell us what's happening today at 3 p.m. And for those like myself who cannot physically be there, how can we support you?
So today at 3 p.m. is a peaceful protest to stand in solidarity as a community and support the efforts that are happening around the world to stand against what happened to our brother George Floyd. So we will have speakers, we have pastors, we have elected officials, we have revolutionaries, we have organizers. What we're talking about is not only going from grassroots, but we're going from inside the Capitol all the way down to the concrete roots, because where we organize as Black people ain't no grass. So this is about bringing all of those together to speak to a collective power that we know we've always possessed, but that has been overlooked. And it will be a peaceful presentation. People will come together. We will have speakers. We will have music. We will have our pastors out there because, as you know, Charisma, right now, this isn't just an issue of white supremacy. This isn't just an issue of people that are seeing folks being gunned down. The results are People are hurting. People's spirits and people's souls are tired. And I wish you was here because you do such a good job at speaking to the soul of our people, especially our social justice warriors. But we have some other pastors, Pastor Caldwell, who's president of NAACP, Pastor James Turner. We have some other great dynamic pastors and reverends who will be there to represent. But this is about holistically healing and uplifting the Black cry. Oh, and for people who cannot come, what you can do is in the chat box, I dropped the Equity Alliance link for you to donate, make a financial contribution. It doesn't have to be something large. Make whatever you can, do the best that you can do. That money will go towards supporting this effort, but it will also go towards supporting the Black Agenda effort that's coming in the next few weeks.
Will you talk a little bit about safety? We're still social distancing. So tell us a little bit how this demonstration is also mindful of that. I see Dr. Kim on the chat, being a doctor, to say, tell them to bring their mask. So what should people bring to this demonstration?
So I'm not going, Dr. Kim, I'm not going to trigger you. So I'm going to say, we have encouraged people to wear masks. We have encouraged people to remain 6 feet apart during the presentation. We've encouraged people, if you are sick, take your temperature before you leave home. If you're running a temperature, if you have a cold, if you're coughing, anything, please do not come. We're being killed by the police. We do not need to be killed by coronavirus.
That's right. Thank you. Again, one more time, Tequila, where will you be? What time? Where can people park? Just give us details of how people can get there. And again, some people are called to be there physically to protest, while others are called to financially support. Others are called to pray. One more time, how can the people that are watching today support the efforts of today?
Mm-hmm. So first, we will be at the parking lot. We'll start at the parking lot across from the historic First Baptist Church, Capitol Hill on Rosa Parks. It is an open state parking lot. There's several parking. The authorities have been notified that we will be there. So you can come there, you can park your car there, and you will be able to see all the people out there and start from there. From there, we will walk up to Legislative Plaza. It's a short walk, but we've put that in there so that a lot of our people who aren't mobile can drive up to Legislative Plaza, and there's parking there as well. And if you cannot support, if you're not able to be there, there are several ways you can support. One, you can give financially. Two, go through your phone right now and text everybody in your phone and make sure that they are registered to vote. Go out and register voters. Go register voters digitally. We need people at the polls so that this energy is not lost. And the other thing that you can do is use your voice. In Egypt, we saw where social media built a revolution. And that's the same thing that's happening right now. We're not just taking it to the streets. We're taking it to the streets. We're taking it to social media. We're taking it to the Capitol. We're taking it to the churches. We're taking it everywhere because we're trying to reach all of our people. So if you're on social media, talk about what's happening. Share your experiences as an African-American person. Share what's happening around the country. Encourage people to get out and participate or to register and vote. There's so many ways that you can participate from being at home, just sitting on your couch.
Thank you so much, Tequila Johnson, once again with the Equity Alliance, who come to share with us this great information. Our staff has pinned the information and how you can donate and support this effort today on our comment section. We're grateful for you and we're praying for you and all who will be there and all of Nashville in our country today. God bless you and keep you, Tequila. Thank you for being here.
Thank you. I received that.
Bye-bye.
Bye-bye.
As we move on with our show to this afternoon, it is my distinct honor to introduce our moderator today. You remember her from the last show we had with Black doctors on here. Dr. Kim is back. We're so excited. She will share with us a little bit about the summer months, children, and COVID-19. She will also serve as our moderator. Dr. Kim, welcome, and I turn it over to you.
Well, thank you so much, Reverend Jean Marie. It is a pleasure to be back here as a medium to be able to get this information out to the community. As we know, children are the future and the children are watching us. So the importance of just what was just shared is that children are watching how we respond and how we react to what's happening in the world. And they're building memories, which will in some ways determine how they respond in the future. And that's what I'm going to talk about at first. I'm here with my colleagues from Meharry Pediatrics. We are the community docs, and we want to make sure that we have the opportunity to share this information with you about how you parent during the summer, we're calling this the COVID summer of 2020, and making sure that our families have all the information to keep our children, your children are our children, to keep children safe and healthy through this, because as everyone is saying, we'll get through this together. And so as we talk about the mind and the memories of children, my biggest concern is for our babies and their learning. The brain is the biggest organ. It works like every other organ in the body. And if you, just a little bit about neurology is that when you learn something, it's actually just a simple chemical reaction that goes. The more opportunities you have to learn it, the stronger that reaction and that bond is. And that becomes memory, and from our short term to our long term, and that's how we learn things. And so the more we practice it, and the sooner or the more recent it is, the stronger that memory. So for our children who have been out for a while, this is something that is concerning. And it's concerning because we face disparities. We're very familiar with our health disparities, but this disparity of education is something that is really tied to the health disparities also. We know that unfortunately, there's about a 30 million word gap between affluent families and families that are poorly resourced. And what does that mean? It means a disparity in vocabulary. It means by age 3, our babies in general have about 30 million less words that they have heard. And without that, we end up with our children who are being around maybe 5 or starting school almost 2 years behind. So if you're 2 years behind, that means that instead of knowing maybe 22 letters, you may know 9, and starting school like that. And these differences we're starting to see as early as almost 18 months. And many of our children never catch up. And if you don't catch up, then what does that do? That means that when you are in 4th grade, you may not be reading at level. When you're in high school, you may still be struggling. And we know that 30 million adults, almost 14% of people, cannot read past the 8th grade level. We know that 60 million people honestly can't read past the 4th or 5th grade level. And this determines jobs, it determines opportunities, just the simple things, being able to read a newspaper, being able to read your prescription that you get from the doctor, being able to read instructions that can keep you safe. So if we don't take care of our children's brains, then we're destining them or putting them at risk of having issues in the future. So how do we do this during this, what we're calling our COVID summer? Normal summer vacations, kids may lose about maybe 2 to 2.5 months of education. Now our kids have already had a summer vacation, 9 weeks, because we've been off. And now we have another 9 weeks. So our kids will have been out of school for over 4 months by the time things get back started. And that means the opportunity for a significant slide in the education and in their knowledge. And for our babies, it tends to be a little bit more. So instead of 3 months, it may be, instead of 2.5, it may be 3 months, which means they're like 4 months behind when they start back to school. And in order to make sure that this deficit does not become a long-term defect for them, as parents, and I'm a parent also, we have some responsibility to make sure that we are taking care of our children's brains as well as their health during this COVID summer. And there are really lots of opportunities to do this. Simple, free things, intertwining learning and everyday activities. If and when you go to the supermarket with your mask, then the opportunity to practice math skills, all right? This is $1.97. If I buy 2, how much will it cost me? This is 10% off. How much will it cost on sale? This is what tax is. If I multiply this by this, what would the amount be? And using simple opportunities to help our kids practice their math skills while they are off. Reading signs, if you go out, if you have the opportunity to see a poster or even go to a museum, being able to read that information with your child also helps them. Those are words that they're seeing and it helps with their literacy. all Metro children on the upper grades have book clubs or have summer readings. Creating a family book club is great. So if you're reading the Odyssey or the Giver like we are, then reading it with your child and have the opportunity to talk some of that out so that they are seeing not only that reading is important for them, but it's important for you as parents also. A family that reads together really learns together. And as we mentioned, if you're eating out, calculating out the bill. If you want that particular meal, it's this much money, how much is the bill? And what's my change gonna be if I give them this $5 or $10 bill? Not sure where you can eat, where you can get change from a $5 bill, but someplace. All right. If you have access to technology, and hopefully the libraries will be back open for our families that don't have it at the home, there are many, many, many free websites that you can go to that can help you structure some of the educational opportunities for your children. There's a massive open online classes, which is available, which is over 300 classes from 62 different institutions in 17 countries. And you can take classes for free. And whatever it is, anything from typing to Spanish to world history to math to calculus to chemistry, whatever it is that interests you to be able to keep your mind going. Old school, you remember, you know, the schools, all Metro students have access to the limitless library through the public library, where they can look and order books and actually get books online also. Summer enrichment opportunities where you can challenge your student and their friends to read however many books and then to get some kind of a reward for completing that. And also just being able to look at the state education website and looking at what some of the standards are, especially some of the ones your child may have missed during this time, as a way of saying, what is it that I know that I want to work on with my child during this time? So the brain, it's an organ, just like you have to take care of your heart and everything else, you have to take care of your brain also. And we still have the theory for pediatrics that parents are always going to be the first and the best teacher. Do not just rely on the school system to educate your children. It's a great opportunity to take out all of those Black history books and read them over the summer. Teach your children, keep their minds going, keep them so that when they start school, they are ready and willing and ready and just all set for this next grade level. We cannot afford for them to slip in this COVID summer. We have got to have them at the top of their classes so that they can take on this fight that we're seeing now in a new and different way that may receive different results in the future. So from the standpoint of the brain and education, just make sure that our children are not the victims of the COVID slide. And we'll say that. And with that, I'm going to pass it on to Dr. Bean. Dr. Bean is the chair, the head, the chief of our pediatric division department at Meharry. She is a long-term pediatrician who has the soul of the heart of the children of Nashville in her, where she's been for many, many years, taking care of our kids from the time they come out of the womb and up until she passes them over to me as an adolescent physician. So with that, Dr. Bean, can you tell us a little about the importance of preventive medicine and why we need to keep going to the doctor during these times of the COVID summer?
Thank you very much, Dr. Kim. And I get the unenviable task of discussing or trying to make parents believe that those routine, what we call routine well childcare visits that we ask you to do are important. And they are especially important at this particular time. As Dr. Kim said, I am started out as a neonatologist, and I'm still a neonatologist, which means I start taking care of patients when they're babies, and then hopefully have the pleasure of watching them grow up into healthy adults. And so it's one of the most best pleasurable part of being in pediatrics is to be able to see a baby and then to see them all the way up to being adults, and then even coming back. And I've had the benefit, being around long enough, of being able to be in the clinic in which I've had both the mother, the grandmother, and all in the clinic at the same time. Would like to remind you all that if you have a question please take advantage of putting it in the chat session so that chat room so that we'll be able to discuss it later. So I'm talking about preventive healthcare, and I'm going to focus mostly on this issue of one of the things that is an unintended consequence of COVID-19. We all know that as part of COVID-19, we're really asked to stay at home, which most of us have been doing, I hope, as well as take the other precautions. One of the unintended consequences, however, has been the marked decrease in the number of children who are receiving what we call routine well childcare visits and immunization. So we've seen a marked drop in the immunization coverage for children. Now we've reached, that's always been one of the measures that we've worked really hard to be able to do in pediatric, is to keep that rate up. And we had reached levels in the 90s, and we have now gone down to levels which are less than the 80s. Now that's extraordinarily important for us, because we have the purpose of, as you hear people talking about, the cure for COVID-19 is going to be to get a vaccine to prevent it. Well, immunizations is this century's main contribution to preventing disease in children. And so we have things such as diphtheria. Nobody here has ever seen diphtheria. I was thinking about it, and I realized that I had seen tetanus way back when I was a medical student and I was on a mission trip to Africa. But we have gotten to the point where things used to be common diseases have gotten to be so uncommon that we believe they're gone. However, the fact that we have had, and all of you must have heard in the news, resurgence of measles epidemic, as well as chickenpox, tells us that unimmunized children and those diseases are still there, and that we need to keep vigilant. And so one of the things that we need to do is really make sure that we keep those immunizations up to date. It's now that school is getting ready to start back, that becomes a particular issue. Now we know that up to 40% of all of our children start school without, their first time they go to school, without having the required health screenings and immunization. And up to 70% of our seventh graders enter seventh grade without those health screenings and immunizations that are recommended for that age group. So we really need to push that issue of trying to get that done. Now, we think a well child care visit, and so does poor child does, as I'm going to the doctor so I can get shots. But in reality, well child care visits are more than just that. It should be. If you have a pediatrician in which the only thing the pediatrician does when you come in is to tell you which shots you are supposed to be getting, then you do not have a real primary care pediatrician. The American Academy of Pediatrics refers to what we call well child care visits as bright futures. And why? Is because the things that are supposed to be done through those visits are designed to improve the future of children, not just in terms of preventing immunizations, preventing diseases, which is extremely important, but also addressing things, and Dr. Kim mentioned some of it, things such as their developmental and emotional health. So those things should be reviewed as part of your well child care visit. The interesting thing is that the state of Tennessee is much more supportive of providing appropriate preventive care to children than almost any state in the union, which is really interesting to me, because it is not known to be overwhelmingly progressive when it comes to healthcare, especially for poor children. But children on TennCare are entitled under TennCare, and the majority of the children we see are under TennCare. And by the way, for those of you watching, 70% of all children in Tennessee are on TennCare and get their health care through TennCare. So that means that it's one of the few times in which disparities should not be an issue in determining access. There are a lot of other things to talk about, but access to care for children should not, and for poor children, is not dictated by whether or not they are poor. It's dictated by whether or not their parents take advantage of the opportunities available to them to take care, to provide health care for their children. A classic example is dental care. If you're on TennCare, you're also entitled to dental care. Though a lot of our parents don't understand, because you have to apply for both of them separately, but they don't understand how important dental care is. So at Meharry, for example, we have a primary care medical home and a primary care dental home. So we're 10 for all of our children who come through to be both healthy and to have all their teeth when they get to be 21. And we're putting dentists out of business or making them go into a different kind of thing. All right, the other thing that's supposed to, so when you go in to see your pediatrician, not only do they give you shots, but they do give you assessments to try to figure out if your child is developing normally and to look for problems which, as Dr. Kim says, may impact their ability to succeed in school. And education is a critical issue for all children, and especially for minority children. And so, as you know, the incidence of ADHD, the incidence of autism, the incidence of school learning problems is extremely high among our children. And the earlier any of these problems are identified and we get early intervention, the better the outcome for our children. And it may not be that we tend to call them a learning disability. It may not be a learning disability. It may be the issue of identifying, as Dr. Kim said, that our children are beginning to fall behind. They begin to fall behind very early. And a lot of the things that we're talking about, that Dr. Kim is talking about when she said what you should be doing at home to encourage your development in your children, are the things that really we try to identify when the children come in and reinforce and give you additional ideas. The other one that we look for, which is extremely important for those of us who are legally blind, is vision and hearing evaluations. Those are critical issues and should be identified as early as possible. You shouldn't have a kid who's 6 or 7 years old who are coming in, who spent the first 2 or 3 years in school not being able to either hear what was being said or see what was on the board until after they had failed. Now, the other thing that I'm gonna only end with that, because I think I've probably used up my time, is to talk about growth monitoring, which is another thing we do. Every kid get weighed. That doesn't seem to be very important. However, when you look at who is dying from COVID-19, you talk about disparities, you talk about the fact that there are a majority of those people are higher prevalence rate among minorities. Okay, that's all well and good, but guess what? They also say that and then turn around and say diabetes, hypertension, asthma. Those are the things that those patients have that puts them at the highest rate. Obesity, which is a major contributor. Those are things we should identify as early as possible and prevent from occurring. So if we can raise healthy children, then we will not have sick adults who are at risk for developing disproportionately these kind of diseases. And some of those things are going to be discussed later on by some of the other speakers. So, Dr. Kim.
Thank you, Dr. Bean. So the importance of primary care and those letting us see our children, because again, I keep saying your children are our children, on a periodic schedule so that we can identify anything that may be going not perfect is key. And to talk a little bit about some of the other issues of summer, and especially around safety, is Dr. Johnson. And as you can see from just our group here, the Meharry Pediatrics, we have men in medicine.
All right. Yes. At our clinic, we actually have we're more male dominated than female, which is, you probably won't find that in many other places. But,
exactly. Take it away, Dr. Johnson.
Yeah, and I'm going to talk a little bit about summer safety in the setting of COVID-19. I have a couple of helpers with me here, my daughter Mia Jewel and my daughter Kamani. First things first, summer safety in the setting of COVID-19. We still want you guys practicing social distancing. So to a kid or to an adult, we say about 6 feet away. Can y'all demonstrate what that technically is, kind of All right, so they're about an arm's length away. So you can tell your kids still when they're going out in Nashville and these different places, try and let them know not to be all up in people's faces like they like to be, and for them just basically trying to break it down to their level. If they're at least an arm's length away from the person they're standing next to, that's probably going to be as best you can get with a kid who naturally gravitates toward being all up in your face. Number two, wearing a face mask. You can get these face masks. The city of Nashville is giving out, I know they've given out over 50,000 of them. I think there's another plan to give out more. We have face masks at our clinic that you can have specifically for your child when you come in, that if you don't have any, we'll give you some. They're different designs. They're barriers to not only protect you, but also protect others, especially those if you have anybody at risk at your home. And then the other thing we like to demonstrate is the hand washing. So those three major things that we've been trying to practice and we've been trying to preach during COVID-19, they're going to apply for summer safety with you and your children and keeping them safe. So washing your hands for 20 seconds. If you have hand sanitizer, using that. If not, good old fashioned bar soap and water still works. Doing this, getting your kids to do it each and every single day, every single time that they go out, every single time that you're going to be around someone, that's going to be of utmost importance during this summer, especially during the setting of COVID-19. And then we're entering now, I think we're now in phase 2 of Nashville's kind of reopening in our roadmap. And so with phase 2, our playgrounds and our parks, they're still not open yet. But in phase 3, I believe some of the metro actual parks or playgrounds will open up, but the metro parks now are opening. And so when we're going out to these metro parks and we're going out to some of these locations that we're getting back and used to going to, still practicing that social distancing is going to be a big part of that. And then now in phase 2, museums are open back up. So as parents, it's like, I've been stuck in the house with them for, going on 2, 3, 4 months, and they're driving me crazy. I've lost all my hair, since, I've been at home with them. And so now you want to go someplace and get them out. Museums are a great place to take them to. Most of the places in Nashville that are allowed to open up, they're allowed to open back up with like 50% less capacity. So again, less people in those groups of 10. I think now in phase 2, we're at 25 up to groups of that, but it's still keeping your distance from people is going to be key to staying safe during the summertime. And then once those parks are allowed to open back up, possibly in phase 3, again, going there, maybe taking some hand sanitizer with you, and again, practicing social distancing with people that are outside of your household. Maybe we'll teaching your kids how to interact with other individuals at a socially acceptable distance. And then I'll kind of segue into 2 of the biggest things that we encounter that have to do with summer safety in children. Number 1 is swimming. The pools aren't open back up yet, but you can have a pool in your backyard. Your neighbor could have a pool, some type of small body of water that your kids can kind of interact with. The sad fact about it is that drowning is still one of the leading, most common ways that children age 1 to 4 die. And it's a preventable death. But yeah, we still see it each and every single summer. We hear these stories about kids drowning. And so teaching your kids how to swim. In our Black community, it's always this stigmatism that you don't know how to swim and that you don't want to get your kids' hair wet, or you don't want to get their hair wet or something like that. But teaching your kids to swim will save their life. And you as an adult learning CPR, how to perform that in case someone is drowning or has been in trouble in the pool and whatnot. And then always, if you do have a kid that's near any body of water, no matter how small that body of water is, making sure that there's at least one adult that has a visual on that individual and on that child at all times. And I'll wrap it up with kind of bicycle safety, because again, kids are out there, they're on bicycles. We have a little bit less traffic right now out there, but we still want kids. Can you go give me a bicycle number, please? We still want kids to practice safety with always wearing a bicycle. And most importantly, not just wearing a bicycle, but wearing that bicycle and making sure that it's appropriately kind of fitting, and that it's not like they're wearing it back here like I used to when I was a kid. So if they do fall, that it protects that brain that you have poured so much time and invested so much into, that they're actually safe and sound if they do have an accident. And that's pretty much it in terms of the highlights of safety. If you look at helmets.org, it will teach you about how to specifically put on a bicycle and make sure that it's fitting your kid appropriately. And then if you YouTube interactive swimming and drowning, there's a video that I would like every parent to watch where you can actually try and identify a kid who's drowning at a pool. It is a lot harder than you think, and it is very eye-opening to see as a parent that drowning isn't always what you think it is. Sometimes it's a silent kid out there that you may not even see struggle, and before you know it, they're gone. And that's something that we can prevent as parents, and we don't have to have any kids that drown this summer, and we can protect ourselves during COVID-19.
Right. Dr. Johnson, excellent. Thank you. I love the hat, the bicycle helmet. Can you talk a little bit about how you know if a mask is safe? We know there's been some stories about the Tennessee Department of Health handing out, I think, sock masks that were treated with a certain kind of chemical that may make them unsafe. What can you tell parents about masks? And then another question is just about sports camps.
Okay, so the big thing about masks, and Dr. Cummings can touch a little bit more on this, possibly I think he will in his speech, is that they're basically barriers. They are preventing, there are some videos out there that show that when you cough and when you sneeze, and when if you're sick with this virus and you release it, it can spread great distances. And so these masks, that if you have them appropriately on, covering your mouth, covering your nose, and snugly fit, that they will prevent a little bit of the spread. They will act as a barrier and keep some of these particles from actually harming other individuals. And if someone is an individual who's a certain distance from you, if you have your mask properly fitting on your nose and covering your mouth, that these particles are less likely to affect you. A lot of the masks out there now that people are having now are making their cloth masks and not the surgical masks that a lot of the healthcare workers have access to and things like that. Are you going to touch a little bit more about the specifics of the mask in what you're talking about, Dr. Cummings? Okay. I won't go too much on that. I'll touch on the sports then. Okay, so in phase 2 right now in the city of Nashville, the CDC and our roadmap says, unfortunately, me being a lover of sports, boxing, one of those big ones, and football and basketball, most of our children and most of us grew up playing sports. But right now, the CDC recommends, and our city and our mayor recommend, that right now isn't a time that we can practice safe guidelines when it comes to playing sports. So the risk and reward, and there is a lot of reward to playing sports, but the risk is so far greater of your child becoming infected with the virus. And we know that 25 to 50% of the individuals out there may not show any symptoms at all. So they may not have the fever, they may not have the cough, but they still may be infected with COVID. And then if they're in these sporting groups where there's really no way to keep kids from touching each other in sports. So right now, just because there's so much risk involved, sporting events are not really recommended. But again, there are lots of sporting events that you can do. So your kids can go to little small sporting events and sporting like running. They can go outside and you can work on them with sprints. You can play basketball with your kids at a driveway, you and them. They can still do sporting type things and events and things like that. It's just our big group sporting events activities at this time is not really gonna be the best thing for our children.
So it looks like it's gonna be a couple more months at home with your kids. So
you're address the issue of the telemedicine now. You're going to bring it up later.
Well, actually, let's have Dr. Cummings talk about the health and the heart, and then we'll come back to telemedicine. So if that was your question, we are definitely going to address it. Okay, Dr. Cummings.
Yes, hello. Thank you very much for letting us be a part of this. This is a wonderful thing to do. So first, just to kind of go back to what Dr. Johnson was saying, masks are very important. Meharry actually is running all 3 of the free sites for testing for COVID-19. And we have been giving out masks, but we found recently that those masks seem to have been treated with pesticides. So we're not recommending you use those masks anymore. But the reason that masks are important is really to help keep others safe. Masks that we have, like cloth masks, as Dr. Johnson was talking about, don't necessarily keep us safe from others. But if everyone is able to wear a mask, then if whoever is shedding the virus, so we always don't know if we are symptomatic with having fevers and things of that nature, you can be walking around shedding virus and not realize it. If you sneeze, you cough, breathe too hard, you're sending those particles out. If you have a mask on, it decreases the amount of particles that leaves your body. And if somebody else has a mask on, it prevents that or decreases the amount that can then go into them. So all together, it actually keeps people from being able to contract the virus because we're decreasing the amount of infectivity or of the virus that comes out. One of the things that I was asked to speak about, and Dr. Bean mentioned it, is these chronic diseases that we have, especially in our community: diabetes, obesity, hypertension, especially. We are seeing more and more that younger and younger patients are starting to have these things. So we're having 9, 10, 12-year-old children who are obese with hypertension and have type 2 diabetes. These are the things that we have to really focus on, and why, one, healthy eating is so very important, and two, exercise is important. The American Academy of Pediatrics has actually relaxed some of their guidance on screen time with COVID-19 because we're locked in the house, and it becomes very difficult to entertain a child for 18 hours a day or 16 hours a day. And so they've relaxed some of the recommendations on screen time. However, they have focused more on making sure that that screen time is productive. So more screen time that includes education, more screen time that includes things that are going to enrich their minds, as opposed to some of the more mindless things that we all like to watch on occasion. One of the things that is very important, and the reason that we have to really focus on the screen time, is that we as parents have to start modeling the behavior of decreasing screen time. So we're having to get off of our phones, we're having to turn the TV off ourselves, because then children will see what we're doing and follow that. And as well as that, we'll also start to make sure that we're interacting with our children more. Data has shown that the increasing screen time increases the likelihood of inattention, especially in preschoolers. If you're watching a screen, there's a lot of information that is coming to them, and that actually decreases their ability to focus. And it's because of all the stimulation they get. Another thing that is noticed is that as they're sitting there and watching television or playing video games, their motor skills start to decrease, especially again in younger children, preschoolers. They are children that really need to be able to explore their environment. That exploring of the environment helps to develop their motor skills. And when they're sitting, watching a screen, those skills can also become delayed. Another thing is that TVs in children's rooms, while they may be helpful for the sanity of the parents, they can be even more detrimental, as it's shown that children who have TVs in their rooms struggle more with academics, and they struggle more with sleep problems. And there can also be a concern that as these children are watching some of these more violent shows or playing some of these more violent games, that they can become desensitized to violence. And then that can increase the likelihood that they'll resort to violence to solve their problems. With the increase in screen time, these kids will also become more sedentary. And at most, all they're doing is exercising their fingers with video games. That's not only a risk factor for becoming overweight, but while they're doing the video games, while they're watching TV, they're snacking. And usually those snacks are unhealthy. And with that, there's more of a risk for obesity, hypertension, and diabetes. So one of the things that we suggest is, if they're doing these things, especially during the summer of COVID-19 and being inside more frequently, we ask that you try to get better or more healthy snacks, fruits, vegetables. There are things like veggie sticks, grapes, bananas, oranges, things that you can give them. They can peel quickly, and then they can eat while they're watching TV or they are playing video games. We also do realize that many of our community live in food deserts. And so it becomes very difficult sometimes for us to go out and get something that is healthy, because all that's around is McDonald's or Burger King and things of that nature. When you're in situations like that, what we ask is you go to those places and at least get the most healthy choice you can on the menu. They have apple slices in the kids' meal. So instead of getting extra fries, make sure they get apple slices and yogurt instead of the fries. All those things are things that can help our children to be more successful in eating healthy and then being more healthy as they grow and become healthier adults. Another thing, and I'll in tune with this, is when we can actually plan events with our children, we sit down with our children, interact with our children. Not only do they see that we are interacting with them, but they're finding and looking at us as the guide to how they will be. So, like I said before, decreasing the screen time ourselves, cutting down on our phone, cutting down on our TV, planning out events. So going outside with our kids, playing basketball in the driveway, like Dr. Johnson said, running races, playing games, finding board games and things of that nature, so that we are all working together and playing together. That will help to, one, bring screen time down and also increase some of the healthy lifestyles that is best for us.
Thank you. Thank you. Thank you. Thank you to all of our folk with this important pediatric information. There are a couple of questions that have come into the Zoom chat. So I know that Dr. Bean was going to talk a little bit about telemedicine, and then in order to get the questions through, I will pass it back to Reverend Jean-Marie, and then she will help us get through a lot of these questions before we wrap up at the end of the hour. So Dr. Bean, tell us a little bit about telemedicine. Remember, you're on mute.
Yeah, I was going to address two of the questions, which was the issue, and they go together. The issue of what kind of symptoms do children have, and whether or not you should, how you should go about treat them, and when should you take them to the doctor. And telemedicine will come in there as an alternative to doing that. And the answer is that children in general have milder courses of the disease so far.
I'm sorry, I don't want to interrupt you, but do you mind me asking the question and then you answer? Because I think it's important that our audience hear the question as well.
Okay, so we see the question. That was
yes, you see the question, but they don't. Do you mind if I do that?
You're awesome. In control. You're the one in control now.
Okay, so the first question is on telemedicine. Could you share a little bit more about what telemedicine is, and is that an option for Tennessee residents?
Telemedicine is where the doctor and the patient communicate in a site other than in the office where the doctor is. It can be either by telephone alone, or it can be telephone and video. Now, telemedicine's been around a long time, and it's actually see little advertisements on the TV about telemedicine, especially now. What has happened is there's something called Hipaa Regulations. So in order to be able to make sure that anything that's shared between the doctor and the patient, they have to, the video or the method you're using for communication has to meet a whole bunch of regulations. During COVID-19, they have relaxed those regulations. So for example, you can now do telemedicine visits using Zoom. You can do telemedicine visits using FaceTime. You can do telemedicine visits using almost any platform that's available at this point. You can do audio only, and that means telephone, call the patient. And in fact, during the time when we were doing stay at home, we called all of our patients to see how they were doing. And what we do at this point, and what most doctors do, is look at those patients they're scheduled to see, and rather than having them routinely come in, call them up, see how you're doing, see if it's really necessary for an in-person visit. At this point, because of COVID-19, and this is not true after COVID-19 is over and we don't know what's going to happen, the doctor can get paid for talking to you on the telephone. However, most real telemedicine or telemedicine is actually a both visual and an auditory. So in other words, you talk to the patient and you actually see them at the same time. And that's what telemedicine defined is at this point. And as I said, you can use a whole number of platforms. And because of COVID-19, the restrictions have been markedly decreased, and the provider will get paid for seeing you as an office visit, will be paid by TennCare and also by many private insurance. Clearly, you're not getting paid, the provider won't get paid the same amount, but it's very effective. So if you have a question, or if you think, and you don't want to come in, or if you're not sure if I should come in or not, call your doctor first. And very often, using telemedicine, you can get access to the information that you need without actually taking the risk of coming into the actual doctor's office. Now you can't do well childcare visits that way because we can't give shots yet we have yet to figure out how to use Zoom to give shots.
The next question, I think, Dr. Beam, you also want to respond to that. It's actually a 3-part question, but any one of you can answer this question. If my child is showing signs of the virus, what is the first thing I should do? And there are several cases where people are showing signs of the virus but test negative. Why is that? Are there any connections?
I'm only going to address the first part and I'll let somebody else address some of the other ones. Most children who get the virus have symptoms that are relatively mild. This is one of the few things that has happened in which children do better than anybody else. So the symptoms they get are very similar to what you would get in any viral respiratory infection: fever, cough, feeling pain, being tired, the kind of stuff you see with the flu. The reason when you should be really concerned about whether or not your child is having, and it's a similar finding with adults, is whether they start having difficulty breathing. So when you start having difficulty breathing, that's a sign you do need to go to the doctor. You should go to the emergency room. Preferably you contact your doctor first. Preferably you try to avoid the emergency room and go to see your doctor unless it's absolutely necessary. But you do not delay if either your child or if an adult is showing evidence of shortness of breath or difficulty breathing. Then that is a major sign. Most children are doing extremely well with this, which is why we're encouraging you to start coming back to the doctor to see further well child care visits. Most of the children are doing extremely well. I am not going to address the issue of testing in children or any of that. I'm going to let some of my colleagues address some of those things. Now, and I'm sure that, and if there is one problem which you all have probably heard a lot about, and that's that one called the new one, multi-system inflammatory syndrome in children. I will only say that's very, very small number of the children, and most of those children did have underlying medical problems as well, which made them increased risk of developing more severe symptoms. So children who have underlying disease are also at higher risk for developing severe disease, just as adults are.
And I'll just add to that, the part about what's the first thing you should do. We're still learning about this disease, and we've read a lot about it and have a knowledge just about symptoms and stuff like that. The first thing a parent should do, if you're ever concerned about if your child has something, is pick up the phone and call us. Just call, and as we said, telemedicine, whether it's a phone or whether it's a video, there is no question that is too small when you're talking about the safety and the well-being of your children. We will be able to walk you through some of the symptoms, decide if it's something that the child needs to be seen physically, or what the steps are to take care of that child, depending on how they're doing at home. But the first thing, if you're ever concerned, is pick up the phone and call us.
Great. Well, any one of you can answer this question. There are several cases where people are showing signs of the virus, of a virus, but test negative for COVID-19. Can you answer why is that so, or are there any connections?
So I can address that. There are a couple of reasons for that. First off, the tests that we do, although I think that I did read that somebody said their test was 100%. It is very rare that anything in medicine is 100%. And so starting off the bat, doing a test will very rarely ever give you 100% assurity of anything. But we've also seen that with the nasal pharyngeal swab, so basically going into the nose, and what we do when we test is when we go through the nose, we're actually getting to the back of your throat through your nose. And so that the testing swab is long, and it's also very uncomfortable. So in getting in there, when we get a very good sample, which can sometimes be difficult, especially in children, there is still between an 85 and 90% chance of what that test says is what actually happened. So you're still getting 15 to 20% chance of a negative, of a false negative, or a false negative, basically meaning that it's negative, but the patient is actually positive. So you can have 15 to 20% of people who will have symptoms, might have the actual disease, and it still says that they're negative. So that is a reason. And also then you put into account how we do the test. It becomes very difficult. You're having to hold children down while you're actually trying to get the swab all the way to the back of their their throat through the nose, and getting a good specimen when you do that. So that by itself can also decrease some of the ability for the test to be accurate.
I know there's a huge push for adults to get tested for COVID-19. Would you also suggest that for children as well?
So the reason that we're really pushing to get so many adults tested is that's going to help in reopening the cities and the economy. Getting children tested is, I've always, and I tell patients this, parents this when they come through, it really should be up to the parents. Children are thought to be what we call super spreaders because, as Dr. Bean said before, it's very unlikely that they're going to show signs. And so what we always say is that if the parent believes that they have been either affected or been around somebody who has been affected, it's a good idea for the children to be tested. But it becomes difficult because, again, it's not comfortable for adults. It's very uncomfortable for children. And it becomes very rough because it's a traumatic experience of having to be held down, and it's worse than flu tests and I believe worse than vaccinations as well.
Dr. J, I'm gonna bring you up in here. Here's a question for you. Our residential camp is planning to be open in phase 4 in the state of Illinois. If we make it to phase 4, would you advise children attending residential camp? Would you be willing to send your children to a residential camp?
So I'm thinking like residential camp, what they're meaning by that is a camp where they're sleeping away. I'm just gonna guess that they're sleeping away at the camp as opposed to like a day camp or something like that. And kind of breaking down with these phases, the phases are kind of based on your city's infectious disease control, along with like CDC officials and governing bodies, where they're looking at the number of coronavirus cases and how actively the virus is kind of spreading and going through the community, and kind of tallying all that together and seeing how fast this is happening and how fast it's kind of slowing down and whatnot. And so some businesses are being allowed to open during certain phases because during the latter phases, they're seeing less of the virus, kind of lesser number of cases and whatnot. And so they're deeming it safer for certain businesses to open up. As far as like a sleepaway though, for me and my house, I probably at this point feel a little bit safer during the phase that we're in right now, and probably even when we do get to phase 4, because I think that puts them at a greater risk than I'm comfortable with as a parent for my children. But again, they're probably going to be going to a camp that during that time is going to have limited capacity of campers. Probably only maybe like 50% or something like that, or maybe even less. But the odds of a child being away at a camp and I can't see them and something happening to them during a pandemic, for me as a parent, I'm not particularly as comfortable as maybe some would be. But again, if you go with what your city officials are saying, that camps during that phase may be safe to open, you can use that as kind of like take that as food for thought, I guess. But if they're asking me straight up, during any phase right now, do I want my children going away to a sleepaway camp? The answer for me is no.
Well, what about any camps without a vaccine? Okay. Would you recommend children to be in the pools and the parks and interacting with children, regardless of the phases that we're in? Would you all, and this is for any one of you, without a vaccine, is it safe for children to function as if we were not in a pandemic? In other words, is it safe to go to the pools? Is it safe to go to sports camp? Is it safe to go to the park? Those children activities over the summer with other children that do not live in their household, is it safe without a vaccine?
I think you have to address that as a parent to what you think about is safety for your child. So safety to me is how close is your child to the front line? Like I'm in the Army National Guard, right? And so there's a front line of battle where the enemy is being actively engaged in kind of a head-to-head battle. And then there's different levels where you're away from that front line. what we know about COVID-19 is that the further away you are from other people, the safer you actually are, in terms of if you're not around someone who's sick or showing symptoms and you're keeping to yourself, if you're sheltering in place, you're about as safe as can be. And so if your level of safety, if you feel like that, if your kid is like a competitive athlete, say, so my children, my two oldest, they're competitive gymnasts. And so during non-COVID times, they're in the gymnastics area and practicing in a gym 4 hours a day, 3-4 days out of the week. And our gym is opening back up. But what they're now doing are practicing safer guidelines recommended by the CDC. They're only allowing 5 gymnasts in at a time, and they're allowing parents, and they've taken us through the precautions that they're going to take, how they're going to be spraying down, how they're going to be wiping down, how they're going to be testing each and every single child that comes in. And so me and my wife and my household, we have to make a decision and decide, do we feel comfortable, even with the things that they're doing, do we feel comfortable sending them out so that they can continue learning the skill of gymnastics? And that's for each and every single parent to kind of decide, along with taking in the information, and they can get help from like us as pediatricians and us who kind of know a little bit more about infectious disease and things like that. And then trying to take into consideration where they're sending their child off to, what type of measures they're going to be taking and putting into place to protect the children.
In medicine, we do a lot of what we call risk benefit. And so consequently, at this point, anytime you're talking about going into a large crowd in a confined space, then there's a significant risk, and you've got to decide what the benefit is. Now, the one that so as far as I'm concerned, any elective activities that involve large groups, children shouldn't be participating in. I ain't gonna participate in them, but that's, again, you have to make a decision about how much of a risk you're willing to take for yourself and for your child based upon the benefit, which comes to the one issue which is the most controversial, or should be the most controversial for children, and in which I don't really have an answer to that one as well, because there's a significant benefit of going to school for children. And so one has to ask the question of, how do we safely send children back to school? And I don't know if there's an answer to that one, other than the fact that the benefit of children going back to school is undeniable, and that as a parent, you're going to have to look very carefully at what your schools are doing to make sure you try to keep the children as safe as possible.
And just to add into that, as parents, we teach our children about how to respond to strangers, how to be careful and stay away from anyone we may consider to be a predator, how to wear their seatbelt, how to wear their helmet. And now it's going to be this, whatever this new normal is, about how to social distance and how to keep their mask if that's the phase we're in. So learning how to live within kind of this new normal, even if the new normal is just another 18, 24 months, whatever it is, it's a new normal. That's going to mean that at some point we're going to have to get out. But as we get out, we're going to have to learn how to do it safely. And one of the recommendations now, and I know we're out of time, for parents, there was a recommendation that it may be safe to expand your family circle now a little bit. If you are comfortable with another family that has been practicing the social distancing, that no one has fever and people have been healthy, it may be safe to expand that, so that now you have your children and maybe one friend whose family you trust, or so, that you can then, that can be helpful. Because as you see, for parents who may be a single parent, you have to work. If you can, my kids are small, we used to call it take one for the team. I got the kids today, I'll be off tomorrow, you're off, you take them. And just figuring out, we're all in this together. So how can we work together to get through these hard times of trying to parent and trying to work and trying to kind of manipulate this new normal. And the best way is, how do you expand your circle in a safe and effective way that allows you a little bit more freedom to do the things that you have to do to survive?
Dr. Cummings, here's a question for you. You talked a lot about, the food desert. The reality is many in our communities is in a food desert, and it's just difficult. So what, and this can be for anyone, but I'm gonna start with you, Dr. Cummings. let's talk about preventative measures. What can parents be feeding their children? Vitamins, foods, drinks. What can parents do to build the immune systems of their children?
To be perfectly honest, if you get a healthy, balanced diet with fruits, vegetables, grains, lean proteins, you're doing better than most already. Vitamin C has been shown to also be very, very beneficial. So giving them daily vitamins, most of the children's vitamins, Flintstones and stuff of that nature have the vitamins that are necessary by giving them that. But really, going back to kind of what everybody was saying, is the ability to stay away from people who have the virus is still the best way of doing it. But the problem again does come when we have these areas of food deserts, of trying to find areas that, trying to find foods that are beneficial for us. And for that, it's something we're all still trying to figure out how we can help these people. One thing I say is, when you do get to a grocery store, when you go down that snack food aisle, you make that as limited as possible. When you go down the fruit aisle, you get that as much as you can. If you're going once or twice a month, however often you go, you stock up on the most healthy things that you can, so that when your children reach for something, they can reach for something that is good for them. And that actually has to happen with the adults as well. Again, going back to how we say the whole old saying of "do as I say and not as I do," isn't really that good, because they're watching us at all times. And so we have to make sure that we're modeling our best behaviors, and that's modeling exercise, that's modeling nutrition, that's modeling everything that we want our children to do. And our community a lot of times doesn't do that as well. We all grew up on, pork. I love pork chops, is my favorite food. So it's just we do that a lot, but we have to learn at the most to do that in moderation, and to make sure that we're having good, strong, healthy foods for our children and for ourselves.
And just to add to that, especially doing some research into different companies that are doing free delivery. And if there is an opportunity for some of the lower cost stores that will take away that barrier of being in a food desert, because you can have things delivered to you, that helps. But as far as the food, as Dr. Cummings said, anything that is processed, anything that has that half of the label is ingredients, you probably want to try to stay away from. The less ingredients, the better. And if your body is trying to figure out what you just ate because it doesn't recognize it as food, then it's going to have less energy to fight infections. So the fruits, the vegetables, the meat, the things that are meant to be edible is a great way to improve the immune system, since it won't be under attack by the processed foods.
Parenting is a sacred gift given to us by our Creator. But it's also, for those of you who are parents, you'll know it's a very challenging experience. And so one of the questions, difficulty parenting full-time, working virtually full-time, single-handedly. So the single parent homes, but even the double parent homes in our community, what suggestions would you give to them in terms of how to engage the children throughout the summer? Dr. Cummings, you talked about the risk of screening, the amount of screening, the TVs in the room. Oftentimes, parents are doing that just for their own sanity. But what would you suggest in terms of how parents can engage the children this summer without giving them high risk to these different things that you mentioned about screening?
So one thing that is very important is planning. I think if you sit down and plan, one, with your children, if they're old enough to actually talk to you, you can really not only help decrease some of the screen time, but also help with your own sanity. Having to work at home virtually, with children running around, having to work at home virtually by itself, if you're not used to that, is already stress-inducing enough. But with children running around, it's going to cause a lot of issues. So having plans of, all right, you're going to have this amount of screen time. We're going to sit down and focus on what you're allowed to watch. There's some things that you can get on your phone. There's something like Common Sense Media helps to focus on what your child's age and what is appropriate for them to be watching. And you can set some of the limits for what they're able to watch. So when they are doing screen time and you're off, not able to see exactly what it is, you can have a better idea of what they are allowed to watch. But another thing is making sure that they're not watching the iPad or whatever off by themselves, so that you can at least have them close to you. There are some things, I found this for my own children. I was having them watching YouTube Kids, and there are people who would splice in things that nobody should really see, definitely not children. And if I wasn't sitting there with them, I would have never known. And so it is planning that, sitting down, making sure that you talk with your children about what we're going to be able to watch. And then when you're away from your work, making sure that you're taking time to spend with them. And spending that time with them, either you can sit down and watch a family movie together, or even better is sitting down and playing a game, going outside and playing with them, running around, deciding we're going to cook lunch or cook dinner all as a family together. Doing all those things will help you, one, to get them outside of watching all the screen time, but it also will help you with your sanity and help your family get closer together.
Dr. Kim, I think we've already might have answered this, but I want to honor the questions that come in. Is it safe to be in a classroom? Is it safe to be in a classroom?
So we're still working out the details of what exactly it means to be, quote, safe in a classroom. And I have to give great kudos to Metro Schools for the work and the time that they've put into the distance learning in the spring, and the work they're doing to try to make sure that they're properly assessing the safety of schools in the fall. The CDC came out with a very long list of requirements for schools to open, from hallways being one direction to the kind of the plastic guards between students if they're sitting down, skipping rows in the classroom so that the students have their social distancing, and trying to figure out how to social distance students during lunchtime. So when it is time for school to be open, it'll be a judgment of all of the meticulous work that has been done to make sure that it is safe for our children to go back to school. I'm watching it closely because I want my children to be back in school also. So I'm looking, I'm paying attention, and my expectation is that they're going to have it together by August so that all of our babies can go back. And if, as I mentioned at the beginning, if we're looking at this slide, we can try to minimalize it since we're already behind the 8 ball. So is it safe? Right now, we're still in phase 2, so schools are not open. By the time that the disease or the symptoms have decreased in the community to the point where it's safe to open schools, that's when Metro will say that we're ready to bring our children back.
Dr. Bean, any idea when we can expect a vaccine?
There is an unprecedented attempt to fast track a vaccine. However, there is a reality in terms of how you can safely make a vaccine that you know is efficacious, and in the words that it works. And that's the real problem. Now, if you listen to some of our leadership, they claim they will have a vaccine by the fall. From looking at the data that's available, and my colleagues can jump in, I think we may have a vaccine by early next year. And I think that is a more realistic assessment of having a vaccine that is proven to work. There are vaccine trials going right now. But vaccine trials mean you give the vaccine to someone and then they have to be exposed to the virus, and then you have to see if they get sick. And then you have to see if they don't get sick, how long does the protection happen? So there's no way to get around the time that's required to be able to prove or to show that a vaccine is effective. I personally think we will have a vaccine by the beginning of next year, and that may be being optimistic, but that's the timeline, looking at what's required to prove that a vaccine is effective, that I think we will have a vaccine that can be generally used. Now, the government has already spent millions and millions and millions and are actually planning to have a vaccine available in the fall. I'm not sure whether they will have the data, scientific data, to show that it's effective by then. But I will give a plug for the fact that we know we have flu vaccine. We know that come the fall, we're going to have influenza again. And African Americans have the lowest incident of actually taking the influenza vaccine. I don't know what that says about what you are going to be doing, what you're going to see when, even if you get a COVID-19 vaccine at this particular point. But it's something that needs to be addressed by the community, addressed at this particular point, to make sure that not only do we have an effective vaccine, but that our populations at highest risk are going to be utilizing the vaccine.
This is a follow-up in our last question before closing statements. If kids can go back to school, do they have to stay away from grandparents or folks with underlying conditions?
Oh, the poor grandparents. Just to follow up with that, we know that our seniors are still the most at risk. My mother is 87, and so it's been very limited interaction that the kids have had with her over the last couple of months, just because of her underlying health issues. Again, before schools open back up, the Metro or Nashville has to hit the parameters for that phase that says they're allowed to open, which means that the transmission in the community has been significantly decreased for a certain number of days in order to show that the transmission in the community is a lot lower. So depending on what it looks like, if for when school first starts, I would say yes, just out of safety until we kind of see how we're doing, and then to continue moving forward. As Dr. Bean mentioned, this kind of risk benefit is something that every family has to figure out for themselves. But once we open back up and the kids are in the building with other people and doing a lot less social distancing after 4 or 5 months, we kind of have to see what happens first. And as long as there are people at home who are at that high risk, then I would continue to do some sort of social distancing just out of safety until we know better. Better overkill than underkill.
Awesome. As we close, I'll start with you, Dr. Cummings. Closing remarks. What should, just a summary of your points and closing remarks for our audience that's watching as it relates to summer kids and COVID-19.
Well, what I would like to stress, I'm pediatric cardiology trained, is exercise. And this is going to be even more difficult in the summer of COVID-19 with trying to keep people at home. Even though you're at home does not mean you can't get outside. And even in some people who are in apartments and areas that are close to parks that have yet to open up, it is still very, very important for children to get out and exercise. And that is almost all ages. And actually that is all ages from once they start crawling till we die. Exercise is very important. We are seeing a lot of chronic diseases in much younger children and things that they shouldn't be having. Children shouldn't be having hypertension and type 2 diabetes and obesity. And yet that's what we see time and time and again, and a lot of times in our communities. So exercise is extremely, extremely important, just as nutrition is. And so those are the things that I really want people to focus on. If it's just having your kid get outside and running back and forth, racing with you around a small area, playing tag, playing hide and go seek, things of that nature, just to get them getting their heart rates up and getting a little bit of sweat will help out tremendously in helping to prevent or ease some of these chronic diseases. Thank you all for watching.
Thank you, Dr. Cummings. Really appreciate you and your time and your dedication to our community. Dr. J, last words of wisdom from you.
Wear a helmet. They save lives, kids and adults. And most importantly, make sure that helmet fits properly. You can save a kid's life. I'm so pro about this. Like, I'll see kids riding down the street and I'll pull my car over and I'll be the old man and I'll yell and say, yo, put a helmet on, please. Because you don't want to see a kid in the ER, a day later or a week later because they were in an accident. and they fail. And, you know, now all those years of parenting, all those years of hard work, now you have to, you know, see a kid that's suffering when they don't have to. So help your kids out, help yourself out, put a helmet on them if they're going to be riding a bike this summer, and teach them how to swim. Our Black community, I know our hair is very, very vital and important to us, but I promise you it's worth it teaching your kid how to swim. And you yourself as an adult, you'll feel a lot more comfortable with them in the water if you learn CPR. And there are plenty of organizations where you can do it, learn how to do it for free.
Dr. J, would you share that website about the helmet again? You mentioned it earlier, the website for the helmet.
It was just helmets, HELMETS.org. And it has diagrams that show you where it's supposed to kind of line up and where it's supposed to fit under the chin strap. And it's really, really simple, and it should be secure. And then if you're ever in an accident, you need to replace that helmet. And there are some organizations, I can't remember, sorry, the exact that have free helmets. I know some clinics will have free helmets donated. So you could even ask your pediatricians if they have helmets or if they know of a way to get free helmets for kids.
Thank you. Dr. Bean, last words of wisdom from you.
We spend a lot of time talking about healthcare disparities among African Americans, and there's no doubt there is healthcare disparities. However, a lot of those disparities are related to our own lifestyle issues, and we really need to look at what is available in our community and what we can do to decrease those disparities. And that includes, for example, for our children, making sure they get healthcare checkup, making sure they have immunization, making sure that they eat healthy and that they exercise. And those things will be something that you can take control of in terms of trying to improve the outcome for your children.
Thank you so much, Dr. Bean, for your time. Dr. J, I didn't say this to you, but both to you, Dr. J and Dr. Bean, thank you so much for your dedication, your time to this work, our community. We're so grateful for you. And finally, Dr. Kim, if you would share your final words of wisdom, but also share how our audience can get in contact with you all. How do we information about the clinic? And I will put that PowerPoint up as you speak.
Well, I think the thank you first, Scarritt, Bennett, and also you too, Rev, for taking the time and the energy for the community to help make sure this information gets out. Meharry is part of the community. We are the heart of health caring as far as pediatrics. My advice to everybody is to read. Have your children read, capital READ. Read this summer. If we can eliminate the educational disparity, then we are on our way to eliminating the health disparities. So make sure you're reading. And if you need some activities for your kids, go to the store, get a 25-cent pack of seeds and start some little empty bottle gardens in your backyard. You can grow some lettuce, some tomatoes, some fruits and vegetables, well, some more so from vegetables. And it's a great opportunity for the kids. They can get out there and weed, and that gives a lot of energy. COVID summer, it's COVID, but it's still the summer. These are some of the same issues that we have every summer for our kids, just with another dimension on it of the pandemic. But we want our children to be healthy all the time, not just now that it's a COVID issue. Come see us at Meharry. Our clinic is open Monday through Friday, 8 to 5. The number is on the screen there. We're in the community. We're part of the community. We are the community. And we want to make sure that this next generation of our children is healthy and ready to be here taking our places in however many years it takes them to train. So be healthy, be safe, and thank you again for allowing us to share this information and for allowing us to take care of your children.
Again, Dr. Kim, thank you so much for facilitating this opportunity to come and invite your colleagues to come and share with our community. So appreciate you, your time, your dedication to this work. I'm so grateful for this partnership that Scarritt Bennett Center is starting with Meharry College. And we want to let you all know who are watching that we've agreed that as much as we can, we'll come together to provide this platform to send information out, more information out to our community as it relates to how to take care of yourselves and your children. And so we hope maybe once a month or every 6 weeks, we don't know how often, but we want you to know that this partnership is solid and we are going to continue this in providing information to our community about how to take care of yourselves and the family and your family, particularly as it relates to COVID-19. As school comes up, we'll have a special with school openings. We'll have more specials. The more information we gather, the more information that's out there, we will try to provide those information to you all. Again, to Dr. Bean, Dr. J, Dr. Cummings, and Dr. Kim, thank you all so much for your time, your dedication, for allowing us to share with you on this platform, to share with our community. We're so grateful for all of that you do and all of your sacrifice in doing this with love and passion. We so appreciate it. Again, we're going to share our screens so that you can see how to get in contact with the doctors there at Meharry Pediatrics. The information is there, and we'll have that also on our website, on our Facebook page for those who are looking for a doctor. Many blessings to you all. There's so much going on today. I want to remind you that there is a demonstration that's happening at 3 p.m. Central Time at Legislative Plaza right here in Nashville, Tennessee. Racism is not a Black issue. Racism is a humanity issue. And we invite you all to get involved however you are able to get involved, not just today, but beyond. We must all come together to dismantle racism in our society. God bless you and keep you, and see you next time. Bye-bye.